Hi, I'm Dr. Sharbell Hashoul, and today let's talk about something many patients hear early in their breast cancer journey: neoadjuvant chemotherapy. If you've just been told you'll receive chemotherapy before surgery instead of after, you might be wondering why the order is different from what you expected. Let's walk through what this means and why doctors sometimes choose this approach. First, let's break down the word. Neoadjuvant simply means before the main treatment. So neoadjuvant chemotherapy is chemotherapy given before surgery rather than after it. This is different from adjuvant chemotherapy, which is given after surgery to help lower the chance of the cancer coming back. So why would a doctor recommend chemotherapy first? There are a few common reasons. One is tumor size. Sometimes the tumor is larger than what would allow for a smaller surgery, like a lumpectomy, where only part of the breast is removed. Giving chemotherapy first can shrink the tumor, which may make breast-conserving surgery possible when it might not have been otherwise. Another reason relates to certain types of breast cancer that tend to respond very well to chemotherapy, such as triple-negative breast cancer or HER2 positive breast cancer. In these cases, treating with chemotherapy first can give doctors valuable, real-time information about how the cancer is responding to treatment. This is something surgery alone can't tell you. That leads to another important benefit. Neoadjuvant chemotherapy allows doctors to actually watch the tumor's response while it's happening. If a tumor shrinks significantly or even disappears completely on imaging, that's a very encouraging sign. Doctors call it a pathologic complete response, when no invasive cancer is found in the breast or lymph nodes at the time of surgery. This kind of information can also help guide what treatments, if any, are recommended afterward. It's natural to wonder whether waiting to have surgery feels unsettling. Many patients feel that way at first. But it's important to understand that giving chemotherapy before surgery does not make the cancer more dangerous or give it time to spread. Research over many years has shown that for appropriate candidates, outcomes are just as good whether chemotherapy is given before or after surgery. The sequence is chosen based on what will offer the most benefit and information for that specific situation, not because delaying surgery poses a risk. During neoadjuvant treatment, patients are usually monitored closely with physical exams and imaging, such as ultrasound or MRI, to track how the tumor is responding. This also gives the care team a chance to adjust the plan if needed. Of course, not everyone with breast cancer needs neoadjuvant chemotherapy. The decision depends on many factors: the size and location of the tumor, its specific biology, whether lymph nodes are involved, and each person's overall health and preferences. This is why treatment plans are so individualized, and why two people with breast cancer can have very different paths even with similar diagnoses. Here's a helpful takeaway. If your doctor recommends chemotherapy before surgery, it doesn't mean anything unusual or worrisome about your particular cancer. It simply means your care team has identified an approach that may improve surgical options or provide useful information to guide your treatment moving forward. If you're ever unsure why a particular sequence of treatment is being recommended, it's always reasonable to ask your doctor to explain their reasoning in plain terms. You deserve to understand the why behind your care. Breast cancer treatment has become increasingly personalized over the years, and the timing of chemotherapy is just one example of how modern oncology tailors care to each person's unique situation. As always, this video is meant to help you understand general concepts in breast cancer care, not to provide advice about any individual case. If you have questions about your own diagnosis or treatment plan, please talk with your own doctor who knows your full medical history and can guide you best. Thanks for watching, and take care of yourself.